All right, I think we have everyone. Hello, everyone. Welcome and thanks for joining. This is HD Genetics' first community stakeholder webinar. Plan for today is to formally, but also informally, introduce you all to the HD Genetics service platform to help you understand who we are, what we offer, and how we can work together. Today's call, we have a handful of folks, different stakeholders from many different areas, people from HD families, we have healthcare professionals, and we have folks from the pharmaceutical industry. We have a handful of slides that should take about 10 to 15 minutes. Please feel free to ask questions in the chat function, and we'll try to address them during and after the presentation. We are going to be recording this call, so we'll follow up with a link to watch it again or share with any of your colleagues or family members who may be interested. Next slide. On a very just high-level basis, I just want to remind everybody of who HD Genetics is. We're a healthcare company specifically offering a best-in-class genetic testing and counseling experience to individuals who are at risk for Huntington's disease in the United States. We do this all virtually through telehealth software. We offer anonymous testing, which is very important to HD family members. We're really providing pre-test genetic counseling sessions for individuals at no cost to them. If they do move forward with testing, we provide saliva kits that go directly to their home. We use HD experts. I'll introduce you to my partner, who's a licensed social worker who works with all of our families. And we really pride ourselves on being a company fully focused just on Huntington's disease and not just about testing. We really try to connect our clients to the right education and resources that they need well beyond their testing experience. A little bit more about why we created HD Genetics. For those of you who I don't know, I've been in the Huntington space since I was 9 years old. At that time, I learned that my mom carried the genetic mutation for Huntington's disease. I spent the last 25 years hosting local fundraisers for HDSA, co-founding the Huntington's Disease Youth Organization, HDO, working in the pharmaceutical industry, and advocating for young people to have the best access to care and clinical trials. I personally underwent genetic testing in 2010. I was very connected to the community, but I went to a primary care doctor who drew my blood, spit out my results, and didn't tell me anything more than that. I was lucky in two senses. I was blessed to test negative for HD, but I was also blessed that I had 10 years of attending HD education days and support groups to gain the knowledge and find the support that I needed to handle this result. Unfortunately, over the years, I've heard way too many stories of people and families who weren't as fortunate as me to be so connected. And their genetic testing experience, instead of being a way to get connected, it sent them into a negative spiral where they then needed a lot of help getting out of. Creating HD Genetics, I knew wasn't going to be easy. This is many years in the running, but I knew it would be worth every ounce of effort to help each individual not go down that downward spiral, but instead to pick them up and support them moving forward. Yes, this has been my baby of an idea, but this doesn't come to life without the support, passion, and guidance of so many other individuals. I've been working with the Community Advisory Board, a handful of folks from HD families who have either undergone genetic testing or who are still at risk, who have been providing a sounding board of ideas of what they truly wanted to see in a genetic testing experience. So invaluable amount. I really want to thank the individuals that are listed on the bottom right of the screen. The bottom left 5 pictures, these are my advisors. They are all volunteers, but they've provided tremendous amount of time, effort, and energy to help create this business, continue to push me and allow me to use them as guidance across the way. They're prominent healthcare professionals in the Huntington space, CEOs, genetic counselors, HD families, and folks from the pharmaceutical industry. So an immense amount of gratitude to these guys and gals. In a handful of states, we need physicians to help order genetic testing. So we have 2 consulting neurologists and movement disorder specialists that we work with in certain states with certain clients to help order genetic testing. Very thankful to have these folks help us and provide guidance and their expertise as healthcare professionals. And last but not least, and really most important, is Wes Solom. Wes and I met about 1.5 years ago when Wes was finishing up his master's degree at Johns Hopkins, pursuing a graduate degree in genetic counseling. He was focusing his thesis on Huntington's disease and how COVID-19 impacted the way genetic counseling is offered virtually. Wes and I created a great partnership, friendship, and officially became colleagues just at the start of this year. And since then, Wes is now a licensed genetic counselor and a full-time employee of HD Genetics, running our day-to-day operations, and is the director of genetic services. So Wes, I'll let you introduce yourself a little bit more and let you go through the next couple slides about the HD Genetic Services.
Sure. So thanks, BJ. My name's Wes Solom. I don't actually come from an HD family, but I do have a little bit of background in the HD space, in that whenever I was in my undergraduate career at Western Washington University, I was studying under Dr. Jeff Carroll in a lab that studies Huntington's disease specifically. Dr. Jeff Carroll, of course, being a co-founder of HD Buzz, was a huge inspiration to me, and actually the motivator for me to seek genetic counseling as a career. So from there, I, as BJ said, went to Johns Hopkins and studied genetic counseling there, and got connected with him as I was doing my graduate research for COVID-19's effect on telegenetic counseling for Huntington's disease. What we're looking at here is kind of the first splash of someone that's interested in the services that HD Genetics offers. So if you go to hdgenetics.com, this is essentially what you're going to be presented with. If you are an individual who is at risk for Huntington's disease, you're at least 18 years old, and you're interested in genetic counseling or testing living in the US, then you're essentially who we're looking for. We are now open in several states, and more states are being added daily. We could go to the next slide. This is an overview of our 5-step process. First is this intake survey. So as you saw on the previous slide, this is what someone might see at hdgenetics.com as a button that says get started. And if someone is interested, they would click that button and be presented with a number of questions that would take about 10 to 15 minutes to fill out. From there, they would be contacted by a member of our team to kind of go over these details and confirm interest, confirm the responses on the form, and set up the first appointment with a licensed genetic counselor at no cost. So that takes us to step 2, which is that first genetic counseling visit, where again, through telehealth, so a video conferencing visit between the client and the genetic counselor, where we talk about all things Huntington's disease predictive testing, all the various details and implications of testing that you could imagine. And one adage that we like to say is, you don't know what you don't know. So we're always really wanting this to be more of a conversation than a checklist of items to get through. So we'll present this as just kind of an open floor, so that we can make sure we touch on all of the details that may come up. If someone decides that they want to go through with testing, and maybe they've been thinking about this for a long time, and we all decide that that's the next best step for them, that would take us to what is step 3, which is shipping out a saliva collection kit to their home from our partner laboratory. That takes about 3 to 5 days for that test kit to arrive. The client would then supply their saliva into this tube. Conversationally, we call this a spit kit. They would essentially spit into this tube, fill it up to a certain amount to this line, drop that tube into a prepaid return shipment envelope, put it in the mail, let us know that they're shipping it to the laboratory. And then at that point, we would set up a follow-up visit for results disclosure, which takes us to number 4. So number 4, we definitely want to make sure that individuals get their information as soon as possible. So we always set up expectations for this visit ahead of time, so that when we get into the session itself, we can essentially start by saying, has anything changed since we last spoke? Do you still want to know your results? And if they do, we go ahead and read them their results, and then move forward by saying, we're going to stay on the line. If you'd like to take a moment to yourself, you can. If you have any questions, we can answer those. and we just kind of treat it very individualized. From there, about 2 weeks out, we'll have a follow-up to check on these individuals and see how they're doing. Kind of, we don't expect, because this is such an emotionally charged time for those sessions with the results disclosure, we don't expect much information to be retained other than the results of those that test. So in our follow-up, we kind of say, do you have any questions that have come up since then? Any thoughts, any things you didn't quite expect and now you're feeling a certain way? Or it's a good opportunity for us to kind of have a little more of a clear air to address topics as they come up. And I want to say step 2 says genetic counseling visit number 1, and step 4 says genetic counseling visit number 2. These genetic counseling visits are not limited to just being the one introductory visit and then followed up by the results disclosure visit. If someone wants to have multiple genetic counseling sessions and they're just kind of wondering whether or not they want to pursue testing, that's fine too. So for example, we could have 3 genetic counseling visits before pursuing testing if someone wanted to.
Wes, we do have one question I want to answer. It's just about licensure and states being open in versus not being open in. And yeah, right now we're open and in a handful of states, and it is based on licensure. Many states, you need a genetic counselor license and a physician license. So what's holding us back from additional licensing is Wes is getting licensed right now in the process across all 50 states as a licensed genetic counselor. Some states are faster than the others. And then we still have a handful of states where we don't have a physician who's licensed to order tests. So we do anticipate being open in all 50 states by the end of the year. But between now and then, it'll slowly start adding up state by state. So more to come.
Yeah. This is a quick kind of visual representation of little details of that 5-step process and kind of our behind the curtain of HD genetics. And that this first point is that the cost, again, those genetic counseling visits that precede testing, so pre-test counseling, if you want to call it that, those sessions are all free. So if someone wants to come to us with a question about Huntington's disease, about genetic testing, they can come and talk to us as many times as they'd like at no cost. If they decide that they want to move forward with testing and we all decide that that's the next best step, then that's where there is a cost. That cost is $500 flat. There's no insurance involved, but that covers the testing and all follow-up services. The testing and the whole process, let's say someone has been thinking about testing their whole life. We have no concerns about them pursuing predictive testing. They have a strong support system. This is something that they've been gearing up for. If they were to come to us and have an initial genetic counseling session and then pursue actual predictive testing, send that sample in, and then have our partner lab analyze it, so on and so on, that 5-step process that we were talking about, that will take about a month all in. So from point 1 to point 5, that's about a month. About 3 to 5 days for the client to receive the kit, about 3 weeks for it to process so that we receive results and can report those back to the client. We're currently available in about 15 states. It's a couple more now. We've had a couple states come in the past couple days. We also want to make sure that folks know that we put a lot of time and effort into making sure that all of our software is HIPAA compliant and the most secure options available. And also important to us is that we maintain the ability to provide anonymous testing. So individuals that are seeking testing that maybe they're not quite sure or certain that they want to share their full legal name on this test just yet, but they do want to know their status, we do offer that option so that individuals can use, say, like a pseudonym to undergo testing and receive their results.
So as I mentioned earlier in the call, there are multiple stakeholders here. People from HD families, people who are at risk. We've created this platform of services really catering to your needs, and a lot of it can be customized But in the end, like, we hope that we can provide an excellent genetic counseling and testing experience that's 100% focused on you, anonymous, low cost, flexible appointment scheduling, all virtual visits. So if you want a friend or a family member who does not live near you to be a part of your sessions, you can do that. But really, the biggest thing we hope to be is a resource for you beyond testing. So the services that HD Genetics offers does not end upon you getting a result. We want to help support you and connect you to the right resources. If that's advocacy group resources, support groups, clinical cares, HD centers of excellence, or possibly if you're a candidate and interested in clinical trials, we want to help get you connected as easy as possible to wherever you want to go. So that's a promise we have that comes with our fee. It lasts forever with HD Genetics. With HD clinics and healthcare professionals, we want to partner and work together and be as collaborative as we possibly can in a handful of ways. Number one is we understand that many healthcare systems may not be able to reach all the needs of patients. And we'd love to be able to support some patients who may not be able to get to your center if in-person visits are required, or if there's too much of a cost, or if you can't do anonymous testing for individuals. We'd love to be able to support that individual through testing, but then refer them back to you for care and potential clinical trial opportunities. We also know that many healthcare professionals who aren't centers of excellence are out in rural America and have very limited access to genetic counselors. So we hope to be a resource for those physicians as a way to get the proper education and support for those patients who are seeking testing. And then, as I mentioned, like, we really want to provide referrals back to centers and HD specialists, so the individuals, clients that we work with are getting the best care and attention based on their needs and their current situation with Huntington's. And then the pharma biotech industry, our hope is really to locate, support, educate, and engage patients who aren't currently connected to this HD community network. There's many family members who are getting tested at primary care physicians and just their local neurologists who aren't aware of clinical trials, who aren't aware of advocacy resources. We want to find those people and bring them into the Huntington circle, and hopefully use that to create a larger pool of patients who might be interested in clinical trial participation. And by doing that, we really, really hope that we can accelerate clinical trial recruitment, which we believe is just good for the whole community. So we look forward to partnering with all of the stakeholders that I've just mentioned in a handful of ways. Although we're early on in our experiences working with patients, this was somebody, one of our early clients, who really provided a testimony. And this is why we do what we do. This is why we open the HD Genetic doors. It was someone who had a hard time finding somewhere to get tested based on their needs, and HD Genetics was able to be there along the way and provide a safe, trusting opportunity for this person to undergo genetic testing. So hopefully one of many, many positive reviews about their experience with HD Genetics. And then lastly is contact us anytime, no matter who you are, what you're looking for. If it's anything genetic testing or counseling related, reach out to Wes with his contact. If it's anything HD Genetics business related, I'm here to answer those questions. You can find us on social media, visit our website. We are going to be out there in the community, spreading word, answering questions, having discussions. We'll be in Nashville next week at the Help for HD Patient Family Symposium. We'll be at HSG in Tampa in early November with a poster presentation with some early data. But we welcome your emails, your phone calls, your questions. We really look forward to working with everybody, providing a new option of genetic testing and counseling for individuals who may be interested. Wes, I don't see any other questions, so I think we'll end it with that. But again, thanks everybody for your time, for your attention, for your support, and your collaboration moving forward.
Thank you, guys.
All right, man. I think I'll
okay.
edit a little bit